My name is Dr. Raj Joshi. I'm a physical therapist. I'm a director of rehab at Holistic Healing Center. I'm excited to talk to you guys a little bit. So just to get used to this chat box, I would like to know if anybody has any specific questions, anything that you'd like to get out of this webinar. Just want to get people used to using this if they need to. Seems like the sound is struggling a little bit, so let me just see if we can get this going all right. Can everybody else hear me? Looks like everything. All right, good. So let me know if there's anything specific you'd like to hear as I go through. I'd like to encourage everybody to hang out for the rest of the set webinar. Stay till the end. I want to allow everybody to sign up for a free medical screening that we're allowing for people that just watch the webinar. So hang out, ask any questions as you go, and we'll kind of go from there. So, like I said, my name is Dr. Raj Joshi. I grew up in Tinton Falls. Currently live in Monmouth County with my wife, my 2 kids, and my dog. I played a lot of sports as a kid, and therefore I had a lot of injuries. I think that I've spent more time as a healthcare patient as I have as a provider. But in 2016, I had an injury like I had never had before. I hurt my back. I herniated L5-S1. And even as a therapist who had treated low back pain, it really opened my eyes to what people that experience sciatica are actually going through. And, it was unbearable. I could barely work. I couldn't work out. I couldn't do much of anything. I couldn't travel. And, the most gut-wrenching thing that I had experienced was having my 1-year-old son crawl up to me and having a hard time picking him up. I couldn't pick up the dog and play fetch with my ball, pick up the ball and play fetch with my dog. So it was tough. It really hurt. And, as a physical therapist, people would think that, this is something I should be able to take care of myself. And I did. I had the tools, I had the information, but unfortunately, I had a hard time making it a priority. I was a new husband, a new dad. I had a house to take care of. I had work, and I really had to dig deep and figure out my why. What is it that I really needed to do to internally motivate it myself? And I had to stop making excuses. So in addition to being someone that has experienced this searing sciatic pain, from an educational standpoint, I graduated with a bachelor's in biology from Ramapo College in 2007. I graduated with my doctorate of physical therapy from UMDNJ in 2010. In the 11 years that I've been a physical therapist, I've worked in a variety of settings. I've done sports-based, I've done private practice, acute, subacute, home care, and I've done a lot of multidisciplinary care, which is like the place that I work now, which is the Holistic Healing Center. I hold certifications in concussion management, kinesiotaping, functional capacity evaluations, and functional movement systems, some of you might have heard, which is the concepts of evaluating patients as a whole versus just treating one specific body part. I've also been McKenzie trained, which is a specific treatment approach to focusing on specific people that may or may not have back or neck pain. So the Holistic Healing Center, who are we and why are we different? I think that unfortunately healthcare has become very predictable and typical, and I don't think that's always a good thing. So, at Holistic Healing Center, we're able to integrate our normal traditional physical therapy thought process with acupuncture, cupping, massage, nutrition, and naturopathic medicine. I think we do a very good job of stepping outside of the box. And I think traditional Western medicine is very intervention based, meaning shots, surgeries, injections. And our goal is to try to help you be healthy as a whole versus just treating that one specific body part that brought you here. So what we're going to be covering, I want to talk a little bit about sciatica and the background, because I think it's something that gets talked about a lot, but people don't really know what it means. I want to talk about the COVID effect, which is something we're all kind of tired of hearing, but I do want to talk about the effect on our patient population and kind of the clinical approach that we're dealing with. What can physical therapy do for me? Why is physical therapy the preferred treatment? What is your why? I talked a little about my why. What is your why? And I want to brush onto that free medical screening that we spoke about. So as a background, back pain affects 50 to 80% of people. They will have it in their lifetime, where 40% of those people will experience one episode of low back pain per year. 34% of societal healthcare costs are related to back pain. 34%. Just think about that. 1/3 of all of our healthcare costs in this country relate to low back pain. All the autoimmune issues, diseases, and other orthopedic problems, 1/3 of cost is related to low back pain. That tells me that we as a whole are very ineffective. The way that we've always done things doesn't work because it's very high cost and it's not effective, because low back pain is the most common disability amongst the working population, which means not only are we spending a lot of money trying to get people better, they're not actually getting better. So the risk factors of back pain. The number one risk factor of back pain is a history of low back pain. What that means is that if you've had a problem, if you've had sciatica, if you've had back pain before, unfortunately, you probably will experience it in some capacity in the future. Other risk factors are heavy lifting, heavy machinery, a lot of bending, prolonged sitting, a sedentary lifestyle, postural stress, age, and the big word is comorbidities. Most of these are self-explanatory, but I want to touch on comorbidities a little bit. This is a word that most people probably had not heard before this year, but we've heard a lot about now. And our hope is that society and healthcare as a whole start to really think about this, right? So whether we're talking about a virus or we're talking about low back pain, it seems like it's common sense that people that are mentally, physically, and emotionally healthier would probably do better at combating things that are uncontrolled. But we don't really treat patients, and our healthcare system is not based around being proactive. So we're hoping that as this continues to evolve, we understand the need to be healthier going into problems. I don't think it's possible to talk about the spine problems without understanding the spine. So if you think about the spine, if you see it from the side, it should have some nice curvature. The cervical spine consists of 7 vertebrae or small bones. The thoracic spine is 12 vertebrae, which goes from about the base of your neck down to your belly button. The lumbar spine is 5 vertebrae, which is your low back. The sacrum is basically a triangular bone at the bottom of your spine, and the coccyx is essentially your tailbone. The vertebral disc. The disc is something that everybody has heard about, yet no one really understands. So for the sake of this conversation, we're going to talk about the disc having 2 major functions, one of which is a shock absorber, right? We jump, we run, our bones are solid, so we need something that has a little give to it in between. The other thing I want to talk about is it's a spacer, right? So a young person with a very healthy, supple disc is going to have a lot of space between those bones, which allow the nerves to come out of the spinal cord and come out without getting impeded. Analogy I use a lot in the clinic is of a fuse box. If you can think about the low back as the fuse box, and the nerves come out of the fuse box through the vertebrae and go down into your legs. So if you could imagine how important it is to have good space between those so that the nerves can come out. The sciatic nerve. The sciatic nerve is actually the largest nerve in the body. And in fact, it's actually a union of 5 nerves that come together and then actually branch out throughout your lower legs. And it passes through your buttock, down the leg, all the way down into your foot. And it's very important because what it does is it actually connects the signal from your spinal cord to the skin and the muscles of your legs. What is sciatica? So I named this the myth of sciatica because I think that I hear a lot about sciatica. I hear about it on Facebook groups. I hear about it in the checkout line in the supermarket, in the gym. And most of it makes me cringe because most of it doesn't make any sense. The thing that most people don't realize about sciatica is it's actually a catch-all phrase, right? This catch-all phrase refers to radiating pain down the leg. Unfortunately, sciatica is not an actual medical diagnosis. But because it's not a medical diagnosis and we can't generalize the cause of the sciatica, we also cannot generalize the treatment of the sciatica. So it can in fact be extremely dangerous to listen to friends and families, even some physicians, online experts, anyone that has not evaluated you saying you should do this for sciatica. Because while some people may get better with your friends' exercises, we actually see a lot of people that get much worse because those things have not been tailored to them. So sciatic symptoms can be anywhere from the low back through the hip, butt, thigh, knee, calf, and feet. We get a lot of referrals from podiatrists because people have heel and foot pain, having no idea that it's coming from their back. And they say, well, it's not, I don't feel back pain, but that doesn't really matter. So if you think about that fuse box and you think about that circuit coming out of the fuse box going through your house, if that nerve is impeded anywhere, it's going to affect the signal. So sciatic pain can also be constant or intermittent. It can be numbness and tingling, hot and cold sensitivity. It can be burning, aching, and shooting. The most prominent thing is it can be as debilitating. This is the part that I really, really did not understand as a therapist until I experienced this. Back pain's back pain. But when you've had sciatic symptoms, it takes over your world. It makes it so that you can't do anything. So the most common causes of sciatica are disc problems, spinal stenosis, SI joint dysfunction, which is essentially at your pelvis, and piriformis syndrome. Luckily, all four of these can very effectively be treated with physical therapy. Okay, so the disc. So we spoke about our disc being the spacer between the two vertebrae. If you can imagine, that disc is like a jelly donut. You might have heard this analogy before, but it works. So if you do certain motions too much, bending, lifting, even just a trauma, what happens if you put a lot of pressure on a jelly donut? The jelly is going to come out of the donut and put pressure on the nerve. That compression on that nerve causes sciatic symptoms. So disc problems are more common with people between 30 and 50 years old. It occurs to males more than females, but most cases do heal with conservative treatment. In fact, there is research showing people that have a herniated disc that go to physical therapy for 6 to 8 weeks, actually, when they do MRIs at the end and they're pain-free, actually no longer appear to be herniated. Okay, so spinal stenosis. Back to the chat box. I want you to let me know if any of you are taller than you were when you were 18 years old. I'm going to assume that's not many of you. And if you, this is why. So if you think about those discs as a spacer, as we get older, that spacer shrinks a little bit, right? It's like shocks on a car. They start to drop a little bit, and it can be a minimal amount, but it occurs. So what happens is, now that that disc space has decreased a little bit, we get a little bit of compression on between the vertebrae, and that compression compresses the nerves and narrows the spine. So this can cause numbness and tingling or weakness in the leg or foot. This is more common with people over 50 years old. And if you or anyone you've ever heard says, hey, you know what, it hurts when I walk, but it actually feels much better when I walk with a shopping cart. The reason that is it actually pitches that angle, and it actually takes the pressure off the nerve. The problem with this is a lot of our people over 50, specifically, over 70 and 80, when they pitch forward, what it actually does is it throws their center of gravity forward, and it makes them a significantly greater fall risk. Okay, so the sacroiliac joint. It's a big word, but if you can think about that sacrum at the bottom of your spine, and it attaches to the ilium, which is both sides of your pelvis, that makes the sacroiliac joint. The problem with the sacroiliac joint is that the fuse box lets the nerves come up out of the low back, and it actually passes through the pelvis. So issues at that joint can cause sciatic symptoms because of pressure on the nerve. People that experience this often complain of leg instability, weakness, but when you test them, they're not actually weak. Pain is usually above the knee, and most commonly trauma, repetitive activities, very common with childbirth, as well as SI joint degeneration. The last cause I'm going to talk about is piriformis syndrome. Piriformis syndrome is something that was very popularly talked about 5 to 10 years ago, and it's died down a little bit. The piriformis is a muscle that goes from your low back, or your sacrum essentially, to the outside of your hip, and it rotates your hip. And the muscle fibers actually run diagonally, so that sciatic nerve passes under it, and in some cases through it. There was a thought process for a while that a lot of sciatica was caused by this. And in fact, most people with sciatica do have tenderness if you were to poke on their glute right where the sciatic nerve runs through. However, research now is showing that almost only about 5% of cases is this the actual initial cause of the sciatica. The COVID effect. So the estimation is that by the end of 2021, 25 to 30% of people will be working from home multiple days a week. And the problem with that is most of those people were not prepared. So they didn't have proper ergonomic setups. People are sitting on their couches with laptops, they're sitting at their kitchen tables. And ergonomic issues mixed in with 30 to 50 hours of sitting in that position can cause a lot of low back pain. We've actually been seeing a lot of that for the last year now, but obviously, as working from home continues, it will continue. Other issues with because of inactivity, weight gain, hypertension, diabetes, cardiac problems, weakness, balance problems, depression, and anxiety. All of these things, unfortunately, go back to the risk factors of sciatica and low back pain, which means that most of us, because of inactivity and decreased activity at least, are now greater at risk for developing low back pain. The last one, which we haven't seen as much of in the past, is the fear of seeking treatment. Understandably so, a lot of people have a fear of going into any public facilities. At Holistic Healing Center, we've actually done construction and changed the layout of our facility. So now we have all private treatment rooms. So for anyone that is uncomfortable being in a busy gym-like office, we don't have that. We have private treatment rooms. We have also developed a telehealth business. So anyone that really, truly does not feel comfortable going into a clinic, we can do telehealth options, many of which are covered by insurances. And this is something we can have a conversation with on the medical screening as far as which one of these you might benefit the most from. What can a physical therapist do for me? I cannot tell you right now what I would do for you because I have not evaluated you yet. And for anyone to tell you what they're going to do for you without knowing what's going on with you does not make any sense. I truly believe that the most important thing that a physical therapist can do for you is evaluate you and create a patient-specific program for you. This program might involve manual therapy for massage and joint mobilizations, specific exercises to address strength or flexibility problems, functional training. How do I lift my son without pain? How do I reach into the car seat? How do I lift something at Costco properly? Education on home exercises and self-management of conditions. So I said that the number one risk factor is a history of back pain. So we need to teach you what to do to avoid flare-ups in the future. And if or when they come, what you should do to calm them down. One size does not fit all. Low back pain and sciatica is mechanical very often, which means most people that have experienced it notice that certain motions make it worse, certain motions make it better. Certain motions make pain go down the leg, certain motions change that pain. Because it's mechanical, a physical therapy evaluation will figure out day one what specific movement patterns will make you better or worse. And by doing that, we can then create a treatment program for you. Okay, so why is physical therapy the preferred treatment? Back to the chat box. How many of you have extra time or extra money that you're happy to donate? Let me know. So, the old medical model, which is something that's been changing, the medical model that my grandparents' generation and even my parents' generation in some ways had was I have low back pain. What I'm going to do is I'm going to go see my primary care doctor. He's a good guy. He'll take a look at it. Most primary care doctors, some will evaluate, some might not. They'll give you some medications and they'll send you to an orthopedist. Orthopedist will undoubtedly give you more medications, probably do an x-ray, even though we know there's nothing broken, just to make sure everything's okay. They might do an injection. They might give you more medication. They'll probably send you to therapy. They might do an MRI and then send you to therapy. So now you've spent about 6 to 8 weeks paying copays, waiting 2 or 3 hours for the doctor, waiting 3 weeks to see him, and you end up in physical therapy. Well, the new medical model is I have back pain. I'm going to go to physical therapy. And interestingly enough, research shows that people that went to physical therapy first have greater long-term, yes, long-term pain outcomes. They have decreased risk of taking opioids, decreased shots, and crazy enough, you have significantly less surgery if you go to therapy first than if you go to a surgeon first. So, why does it make sense to spend 6 to 8 weeks and a lot of your time and your money if it's going to bring you back to the same place? On the last slide, I said going right to the physical therapist. So, right now we have direct access in New Jersey, which is great. And what it means is if you call me tomorrow, I can get you in my office today, tomorrow, the next day. We do not need physical therapy prescriptions anymore, which means that you can come right in. If we do an evaluation and we decide that you are a candidate for physical therapy, or we decide we need to send you out to see somebody else, we can absolutely do that. But now you don't have to wait that 6 to 8 weeks to see three different gatekeepers to get here. Okay, so chat box. So, how many of you have gone to a specialist or a doctor for low back pain or sciatica, and that specialist never actually touched you? Does that happen to anybody? An expert evaluation, someone that wants to change the course of your prognosis and make your life better to treat your low back pain, should be doing the following: taking a history of your back pain. What makes you better? How did it happen? What happened? Was there a trauma? What is your medical history like? What makes your pain better? What makes it worse? I want to look at your range of motion. I want to look at, are there certain tests that make you better or worse? What's strong? What's weak? Do you have flexibility problems? Are your reflexes intact? Do you have sensation issues? Do you have muscles that are tender and tight? How do your joints move? What are your specific goals that you want to accomplish? Think about going to a mechanic and saying to a mechanic, when I drive over 55 miles an hour, my car shakes. When I hit the brake, it just completely stops. The mechanic opens the hood, looks at it, and says, I could fix it. That'll be $3,000. And you say, well, don't you want to watch it drive or hear how it sounds or see what I'm talking about? No, I'm good. How would you feel about that? How is that any different than an x-ray where you're not moving, which also means you're not in pain, and a 3-minute conversation? Treat the patient, not the picture. This is something I say in the clinic a lot. People are probably sick of hearing me say it, but I'm pretty passionate about it. I heard a good analogy from a doctor, and I'm going to steal it. And what he said is that imagine someone 60, 70, 80 goes to the doctor for headaches. And the doctor says, I know you have these headaches, but I think they might be caused by your wrinkles. I think we need to treat your wrinkles. And the patient says, well, how does that make any sense? That's just kind of a normal sign of aging. And the analogy is that this is essentially the same thing as telling someone they have back pain based on an x-ray, right? If we look at people 40, 50, 60, 70, 80 with no back pain at all, it has a lot of the same things on the x-rays as when the orthopedist says, so I looked at your x-ray and you have some degeneration, a little arthritis, some bone spurring, you have a disc problem, and you have stenosis. It's the same thing. These are normal aging processes. They do tests time and time again, thousands of people with no pain, and they have x-ray images that show these same things. So why are we not treating the patient? Why are we not treating what makes you better? What makes you worse? Why are we just treating the picture? It does not make any sense. All right, so earlier I spoke about your why, figuring out what is going to internally motivate you to make changes in your life. This was my why. I could not fathom the idea that I would not be able to travel or sled or go to the beach with my family. I could not imagine that I couldn't pick up a ball at 30 years old and throw it to my dog. It's not something I could handle, and I had to get myself ready and understand that this was my goal, and this was not something I was not going to accept defeat, and I refused to be stuck in that situation. So we have to figure out, what is your why? What motivates you? Do you have fitness goals? Do you want to be able to travel, play with kids, play with grandkids? What are the goals here? What can you get? Instead of just being in pain, instead of being miserable and not being happy because of this constant pain, what is going to motivate you to go and figure it out and try to make changes in your life? If you will not do it for yourself, because we all know someone who says, I'm in pain, it's not going to get any better, this is just how life is, then who are we going to do it for? Is it someone we care about? Because we know when we're in pain, we are not a happy person. And when you're not happy, people around you know it. So who are you going to do this for if you will not do it for yourself? So we are offering a 15-minute medical screening. This is a phone call. It's a conversation. It's free. There are no strings attached. The goals here are to have a conversation and see if you would benefit from physical therapy. If we decide you would benefit from physical therapy, we can talk about it and figure out what the options are. But this is a 15-minute conversation. There's an offer on the chat right there. When I end this chat, it will be there when I end the webinar. And if you're not computer savvy, feel free to call the office. Let them know that you listened to the webinar and you want to set up a screening. But like I said, whatever you do, do not let yourself be miserable. Do not let yourself be in pain. At least let's do what we can to try to help. So I appreciate you taking the time to listen and talk. I hope everybody has a great day, and I hope to see you soon. Thank you.